Give me a thumbs up when you are ready. Good morning and welcome to the second session of Success Summit 2023. Today we'll be talking about staffing challenges for home and community-based service providers. But before we begin, first, my introduction. My name is Anand Chaturvedi. I'm a care business coach, and for the last 12 years, I've been working with a lot of care providers, home health agencies, case management, adult day health centers, personal care homes, you name it, across the country, to help them run their business more efficiently without adding overhead. This session is kind of different. I'm taking all my learnings and offering you in a group setting so that you don't have to pay me a lot of money like other people have done for one-to-one consulting. Today, our session is staffing challenges, as I said earlier. And before I begin with my slides, let me do some housekeeping things. When you're watching this video in the academy, please know that everything that we need for the session today is right on the same screen. So you don't have to leave the screen or go somewhere else. This is going to be a very interactive session. What I mean by that is that in the next 58 minutes or so, you will be looking at my methodology that I have developed to help providers around the nation to minimize the impact of hiring decisions, how to increase retention, how to recognize the good employees, and so on and so forth. But we will also look at the case studies of a home care provider in this case today. And you will be able to see what his challenges were, why those challenges were important, what did he do, and very importantly, how did he do it. This is going to be a very interactive session, and we will cover a lot of ground within an hour. And again, remember, this is the second session of the total 6 sessions. So if you stay with me and attend these weekly sessions on every Wednesday, we have 4 more to go after this one. I would help you in creating your own success plan for 2024. That's my promise to you. So without further ado, let's begin. Please, let's look at the slides. You have heard the methodology of SMART. We use it in every area. But today, I'm going to use this acronym, SMART, for staffing. Let's see how. Next one, please. So the first alphabet, S, stand for specifying roles. Now, you might say that we are a very small business, or you might have a mid-sized business with 50 or plus office people, or you might have a multi-location business in many states. But there should be one thing in common. For every individual who is in any role in your organization, including yourself, you need to specify what that role is supposed to do. And you don't have to start from scratch. There are some best practices, and we'll look at some in our time together, so that you can simplify and you can specify what these roles are, so that you are not missing any critical responsibilities. The next alphabet, M, stand for mastering recruiting. We all do recruiting, but have you mastered the art of recruiting? We'll look into that. What does it even mean? The third alphabet, A, stands for assessing performance. When you have the right people identified, right roles, and you have hired them, how do you assess their performance on a regular basis? It's easy. We'll see how. And the fourth alphabet, R, is for rewarding contributions. Rewarding doesn't have to be in financial or monetary means. You can do, in other words, recognition and rewards, and you will see how. And the last but not least is T for training skills. Training goes beyond the in-service. And how you can do that easily, we will see that in this conversation as well. And again, remember, this is a conversation we are having together. So if you have any question for the speaker, please feel free to send them in the chat. You will find that in the right-hand section of your screen in the messages. So feel free to ask me any question during the presentation or towards the end of it as you feel fit. Next slide, please. So let's look into specifying roles. As I said earlier, each role has to be clearly defined. Now, you might have one individual playing multiple roles, and that's fine, as long as you know what those roles are. I give you an example. If you have a person who is doing scheduling of caregivers, is the same individual also responsible for calling upon patients and their families to make sure that the caregivers are arriving on time? Or does that responsibility fall on someone else? If you don't define that, then the chances are nobody's going to do that. And then you will see that in the quality of your business. So think it through. Each role has to be clearly defined, and you will see how you can do that. When you have clearly role definition, responsibilities come into play. And these two, role definition and responsibilities, are critical in defining job requirements. Why is that important? Because that's how you know whether you are hiring the right person for the job. And you will see in an example as we go down this path. Next slide, please. When it comes to recruiting, the art of mastering recruiting has three nuances. The first part is streamlining the hiring process. Now, I have worked with several business owners where identification of a new vacancy or an open position is often jotted down on a piece of Post-it. And then somebody passes a Post-it note to someone else, and someone else posts that in LinkedIn or some other tools, local jobs, and so on and so forth. When they have a new recruiter, the new recruiter follows a different process. And in that process, what happens is, since everybody is using the individual approach, you never have a streamlined hiring process that can reflect your brand values to the potential applicants. If you don't have that, then the second bullet point, attracting qualified candidates, becomes a challenge. So you have to have a process first before you can attract qualified candidates. And when you do so, in doing so, or for needing to do so, you have to have a very clear roles and responsibilities written or posted, so that people are not surprised when they come for the interviews, or even worse, after you have done all the background checks and they are hired, and then they realize that they are not the right fit because either they don't speak the language or they cannot work with the pets, or so on and so forth. And that's how you focus on hiring the right talent. And again, we will be looking at all of these in a practical scenario as we go down the case study path. Next slide, please. So far, we have identified the roles, specifications. We have mastered the art of recruiting, found the right person. Now is the time to assess their performance. If you are not able to implement a consistent process to assess each individual's role and contribution, you will have a problem down the lane. Why? Because either you will not know who is the right person for the right role, or you would not know whether they have some hidden talents that you are not able to recognize. So always tie performance to what they do on the job by implementing performance reviews. And this is doable even in a small 5-4 people group setting. I've seen that implemented, and we'll talk about how. Link rewards. Rewards, again, as I said, don't have to be monetary all the time, although that doesn't hurt, but they don't have to be. And always give constructive feedback. Next slide, please. So since I said that they don't have to be monetary all the time, let's look at a couple of examples. You can have a system of recognizing key employees. I have seen several home and community-based care providers implement a caregiver recognition or a nurse recognition system, in which by doing the right job, by collecting patients' feedback, they are able to recognize the employee of the month. And that has been done without any bias. And all those things are doable. We just need to have a will to start somewhere. Next slide, please. Training skills, as I said earlier, it goes beyond regular in-service trainings, although the importance of in-service trainings cannot be overemphasized. I have seen so many companies where they are in a rush when the employee is about to complete the 1 year and they are still not done their mandatory 8 hours of in-service trainings. People are maintaining Excel spreadsheets. The trainings might be duplicative. Caregivers might not be interested in coming to the office and all those things. But all these can be resolved. We have found in some surveys done by some third-party companies that especially younger caregivers appreciate getting regular training because it does help them in building a career in the healthcare industry. You can offer the same, and they are not expensive. You can also have your own individualized onboarding trainings. They are not expensive either. You can even use master templates created by some other agencies. You just need to have your own vision and mission statement so that you can encourage people to be their best. And last but not least, this is something that I have seen work with very good results at some places where people are pairing new employees with mentors. And these mentors are employees who have been with you for several years. They understand your values. They know how you work. They know the needs of caregivers. And they can become informal guide and counselor to the new employees, so that if the new employees have any problem, and if they are hesitant in asking the scheduler or the case manager or the care manager, they can reach out to a mentor. This will help both. This will help the mentor because then they can practice leadership skills. And this will help mentees because they don't have to suffer in silence, especially if there are things that they don't feel comfortable sharing with their superiors. So that is it as far as the slides are concerned. But we are just beginning. So now what I would like you to do is to take a short survey, just a couple of minutes. And after that, we will look at a short video, a 3-minute video of an actual provider. And we have changed the name and images to protect the privacy. And then you will be able to see why this is also important. So please take a time. Take the first survey. Thanks for filling the survey. Now we are going to take a couple of minutes and then see a case study of an actual provider. Please roll the tape.
Would you like to learn more about solving staffing challenges as a care provider? In this video, we will learn about Mike. 5 years ago, he opened Sunny Home Care, hiring 3 caregivers he knew personally. Mike started small, taking on clients slowly to ensure exceptional care. As word spread, demand grew. But Mike struggled to staff all the cases. Turnover was constant. He could rarely find qualified caregivers. He was overwhelmed trying to fill shifts. Last-minute call-outs left clients without care. Mike filled infrequently, disrupting his own work and family time. Morale sunk. He had hoped things would get easier, but the headaches persisted. Unfinished schedules, paperwork, everything. There just weren't enough hours in the day. Losing sleep, he worried about letting clients down. His dream of building a top-quality care agency was unraveling. While Michael offered competitive pay, he knew he could not match the pay rates offered by other healthcare providers across the street from him. His few top performers took on the toughest cases without reward or recognition. Over time, their morale eroded, leading to the exits he faced now, and the worst part is, he barely knew them and also those who stayed. Michael's mind flashed back to his early hiring days. Eager to expand, he rushed through interviews asking only surface-level questions. Several hires seemed enthusiastic initially but struggled with the demands of the job. Without structured onboarding or training, they never hit their stride. Late nights he agonized whether to give up. He had poured his savings into Sunny Home Care, and the time was running out. He didn't know how to turn things around, but he cared deeply for his clients and employees. He had to figure this out. Thanks for watching this short introduction to Michael's story. But he did turn his business around completely by following the SMART model. Stay tuned, and you'll know how he did it.
So that was a short introduction of an actual provider. We changed the name to Mike. And interestingly enough, we have another question from the real Mike, which is about caregivers who in Georgia are serving structured family program. And as you saw in this video, even in the SFC or structured family care program, where caregiver is a family member, their problems are slightly different than a non-family caregiver. But as you saw in the video, the solution lies partly in the training and the onboarding. Even for the family caregivers, onboarding and clearly specifying what those responsibilities are absolutely critical. In the case study, the protagonist, Mike, hired anyone who would volunteer. And this, unfortunately, is also the case for many of our providers today across the nation. Given the shortage of applicants, shortage of nurses, shortage of aides, and so on and so forth, CNAs. But whoever you have hired, have we taken time to clearly specify what those roles would mean? And what are the positive or negative repercussions, if any, if they fail to adhere to the right behavior? Part of that begins at the very beginning. I would now ask you to take a short survey right after this case study, when it is still fresh in your minds. Welcome back. If you are still working on your survey questions, just remember that this academy will be open for you until end of this year. So if you have missed any question and if you have not attended our last session, which was done on compliance, you can come back and then check their videos as well as finish those exercises, because we would like you to benefit from that training material as well. We know there are a lot of you who are joining for the first time today. So please make sure that in the next few weeks, you find some time and watch the first session, which was on improving compliance with Medicaid. Okay, so after we finished this case study and you took the questions, we answered the first part, why it was important for Michael to fix his staffing issues, because they were turning into existential issues for him. The constant turnover of employees, which was adversely affecting the quality, and also his revenue, created serious questions about the future of his business. But Michael didn't stay to suffer. He actually changed course. So now let's look at a checklist that he prepared, and you and I will be looking at this together. Please roll the slide. This checklist is built on the SMART plan. And what he did was he didn't do a lot many things for each of them. He just cherry-picked a couple. But what he did was he tried to address all the 5 areas for his staffing. So let's look at the first one. While we are waiting for the slide to come, again, these checklists are also available in the Academy section. So you would be able to see there are a couple of points. Support team, do we have those checklists in the Academy?
Yes, sharing.
So as you see on your screen, for the first alphabet of SMART hiring method, S, for role specifications, what he did was only 2 things. He updated job description for each role. He already had those. He had to make sure that those things which are bothering him, he was able to write them, add them up, so that he can give it to his current employees as well as to future applicants. And then for each role, he also added required skills and responsibilities. That's it. But that simplified his hiring process a lot. And how? We will see in his next checklist. Michael identified 3 action items to improve his recruiting process. Rather than just relying on hiring through social media or free accounts in job sites like Indeed or Monster or some other places, he, in addition to doing all those, he also started to network locally, especially at the places of worship, where he could sometimes find people who had experience in caring for a family member or a relative. And he could mentor them, help them get their necessary certifications, counsel them to get necessary experience, and so on and so forth. He also streamlined his interview process. And what he did was pretty smart. He created a question bank so that irrespective of who is doing the interviews, the questions were always consistent. And then last but not least, he started measuring hiring velocity. Now, what does it mean? It basically means that by the time you advertise a job and someone or some people apply, then you select the right person, then you get the background checks, then you onboard them. When do you start them in their first job? So from the time of posting the open job till the time this individual or new individual starts this job, he started measuring those. And what he found was that many times the recruiters were quick to post a job, but the follow through had some roadblocks. Sometimes people will forget that individual X is still waiting for certain documents or certain actions, or that we never scheduled the second interview, or they sent the incomplete data, hence they were not eligible to start a shift, and so on and so forth. But since you started measuring those matrices, things did speed up considerably. Next one. Is on performance assessment. Michael did two simple things. He promised himself and his employees to do a 3-month and annual review. So 90-day review and annual review, where he will sit down with his staff members and he will give his core team a performance feedback. And then they will also have a performance feedback session with their own team members. So the schedulers will give some sort of a feedback to the caregivers or whomever they are working with, so that everybody is on the same page. That feedback loop was very instrumental in encouraging the right behavior and also addressing those behaviors which Michael was not too happy about, but those were never communicated. Next one, please. In the contributions reward, Mike instituted a process in which he could recognize top performers in his team. Now, since he has already laid out the roles, responsibilities, what was needed, the matrices of performance, it was relatively easy. You see, the key for having any program like this is to make sure that you start right from the very beginning. Since Mike did those couple of things for each of those sections, by the time when it came to recognition and rewards, he had a rather simple task. He only had to adhere to it. He announced Employee of the Month program, and those employees were actually judged based on a very objective criteria that they were aware of and their supervisors were aware of too. That removed any bias in these performance reviews. Next one, please. Training. Michael was already having the in-service trainings at his business because they are mandatory. But in addition to those, he made sure that there is a schedule that he published to his staff members that every week on a certain day, certain time, some trainings will take place. And those who did not have any shift, like caregivers, were encouraged to come and do certain trainings like CPR, which could not be done remotely. And for everything else which could be done remote, he turned those trainings into a remote curriculum that he could monitor. In addition to those, he also offered tuition reimbursement for certain certifications. Now, those of you who are in any states like Georgia and are part of any state association, you know that you can get a personal care attendant certificate at a very subsidized price, and several other states also do the same thing through the state associations. And then he actually advertised that if people have experience and would like to be certified, Mike would pay for this tuition reimbursement as long as they stay with his business for 90 days or 6 months or something like that. And that also proved very successful. And last but not least, he implemented the mentor system. Now, again, as you see, all these things are not rocket science. The key was he was able to do that. So the question you might have at this point in time is, okay, we understand why he had to do it. We can identify with his predicament. We also understand what did he do, but then can you show us what exactly he did and how did he do that? So what we did was we took a few screenshots, and all the names of individuals that you see are just placeholders. They are not real people, and in some cases we have even put a mask. So I will show you some real examples of his workflow. We will begin with the first part, specifying the roles. We saw that he updated the job descriptions and each role and defined. How did he do that? Let's roll the tape. And we are looking at it. So can you pause for a second here? So here you are looking at his HR system or hiring system. He had the job introduction, job responsibilities, job requirements, all typed one time. And in some cases, these also come pre-populated so that he doesn't have to explain to one odd individual that why, their performance is lacking, because when they applied for this particular role or when they were interviewed for this particular role, those responsibilities were clearly communicated. Please continue. Did you see caregiving skills, transfers, and so on and so forth? Now, this was a very simple task. Take each role, specify what the roles are, qualifications are, skills are, and so on and so forth. Now, that serves two purposes. When you're hiring somebody new for that role, you already have the job template created. And when you're assessing someone's performance, you already know, and they already know, what the job responsibilities are. So this is very transparent in both cases, applicants as well as existing employees. So the next piece he did was, after he finished the roles and responsibilities, he started to improve his recruiting process. Let's roll the tape. So of course, the first thing was he started talking to the local places where he could find caregivers. And in addition to that, he also worked on improving his interviewing process, the hiring process. Let's see how he did that. So can you just pause? So here you see, just take a pause here. He had created a question bank. As I explained to you earlier, now in his system, not only he has questions prepared for each role, the recruiter is noting down the key answers that this individual gave to this recruiter before the recruiter is giving a star rating or any rating to this potential applicant. Now, this does two things. First, it eliminates any bias because every recruiter is asking the same questions for the similar type of roles and responsibilities. And secondly, since they have made a note of the answer that the applicant gave at the time of interview, they always have a reference point to go back to. That is this something that this applicant said that he had or he could do or he had skills to do, and so on and so forth. So this gives them extra data point. It also gives more transparency to the system. Please continue. And then, of course, you can have different questions for phone interviews. And if you are bringing somebody for in-person interview, you can have a second set of questions. And as I explained earlier, Mike started measuring the hiring velocity, which was how many days does it take for a new individual to start. And in this case, I think you're looking at the sample data. He had 2 individuals that he hired in 1 month, and on an average, it took them 25 days by the time the job was posted to the time they started. Now, once you have these kind of reports in front of you, like Mike did, then he told his recruiters as well as his schedulers, can we shorten this time frame from 25 days to 20 days, then 20 days to 15 days, so that if they can reduce this time, they will have a happier caregiver, and they will also minimize the revenue loss that they were incurring because of no-shows or because they were not able to fill shifts. Let's continue. Then the third piece of the puzzle was performance assessment. Let's see, what did Mike do in that case? Can you take a pause here? So here in this system, what you are looking at is Michael could see that there are 4 of his caregivers. One of them, and again, this data is fictitious. Of course, in real time, you will have better caregivers than the ones which are shown in your sample, but we had to change the names to protect privacy. But you see that here in one simple screen, Michael and his HR manager could see all his employees, all his caregivers, for the behavior that they have exhibited for the period of last 30 days. At the very top, you see the time frame is September 1st to September 30th. And how many of them, had 80% task completion, which was basically the minimum. You would like to have 100%, but in case of Mike, he thought that in some cases, caregivers, might not be able to do all the things because client would refuse certain things, which is fine. But then you can see in one line whether they were able to take client signatures. Did they get a thumbs up rating by the client? Did they complete all the trainings? Are they tardy or are they always punctual? And so on and so forth. All those behaviors actually accumulated points. So now Michael created a sort of a gamification for his employees, so that the employees who are performing with the right behavior are excelling in their peer set. Please continue. And not only that, in the same report, Michael could also see who are the people who actually missed the opportunity. So these are basically the individuals who are not expressing the intended or the right behavior. So if there were people who were, getting good points, you could see them from a score from topper, first 5, first 10, first 20, first 50. But also, at the people who are at the bottom pile, who are they? When were they hired? Is it a problem with their recent hires? Did they hire? So this is again a very high level view, but in just a couple of clicks, Mike was able to ascertain how his hiring is working, how his training is working, how his employees are working on a day-to-day basis, and so on and so forth. So with that said, let's move to the next part, which is once you have identified who are the individuals or your team members who are exhibiting the right behavior, how do we reward them? Please take a pause. So in this case, as you saw in the last particular video, when caregivers were showing up on time, doing all the tasks, capturing signatures, getting good reviews from the family as the family members, they would accumulate points. And now the individual for that particular month who scored the highest points can always check in their app if they are the first. So if they are not first for the particular month, it would create a friendly competition. Or let's say if today is 27th and I still have got a few more days left in the month, perhaps I will do extra in the next 3 days so that if I am second, I have a shot to become the first. And so that I can be awarded Employee of the Month certificate. It could be done in person with a actual paper-based certificate every month or every quarter, or you can also deliver the same thing in their mobile app. And again, it doesn't require anything different. They are doing the same job. The only thing that changed was Michael started to recognize that. Please continue. And again, when you have these points, it's not that the points were for nothing. If the employees wanted, they could have requested a redemption. Redemption could be for something which could be monetary, and again, it could be something non-monetary. I have worked with a provider who started to offer a paid day off if an employee is consistently, in the top 3 or something like that, because when he did his own employee survey, the first thing, because he checked whether people would like to get a gift card for Walmart or a gas card or something like that, but the one option that got the maximum votes was, can they get a paid day off? And they did some financial analysis, and they said that if someone gets Employee of the Month or the first 3 positions for 2 months or whatever time frame is, they will be able to earn a paid day off. Again, this was their story. You can do something different, but the point here is these are all doable things. Let's move to the next one. Training. So yes, Michael started to have regular in-service training. They were earlier done too, but they were not regular. They were not published. Now this calendar was published beforehand so that employees knew that if they missed this Wednesday training, they could come to the next Wednesday and so on and so forth. Let's continue. But in addition to that, the HR manager or the employee specialist at this particular business was also able to assign virtual trainings, videos to the caregivers. They could do that in a part of a group, like assign videos related to bathing and dressing in this particular case to all caregivers or to select caregivers and so on and so forth. Please continue. And then in addition to that, they also implemented AI tools. So using an AI tool, this training would automatically be triggered for caregivers who are handling a client with a specific diagnosis. Now, think about that. This is the power of AI. And we don't appreciate it because we hear about us all the time, but we don't think that it may be applicable in our industry. But we are seeing that more and more cases of AI-based applications are happening around us. In this scenario, what is happening is that if a caregiver is taking care of somebody, say with diabetes, or with someone who has specific diet requirements, if the caregiver has not done a training in the past 90 days or 180 days on that particular topic, before the shift, a night before the shift, automatically a message will appear on their app, on the caregiver app. Hey, we know that you have a training, or we know that you have a shift tomorrow. This training might help. And not only you will be able to take care of your client better, but you will also accumulate points. Now, his care quality improves. In-service training is more meaningful. And caregivers are also learning something which they actually need immediately. Please continue. And now he could also see his in-service completion reports. Which employee did what trainings? How long did they do that? And now, if he ever comes to present this report to his auditors, he has all the data, or his HR manager have all the data that they need to show that not only the caregivers or the employees completed the training, but the trainings are also relevant. Let's complete this. Any questions so far? I know that we keep these sessions very fast. And this is on purpose because we value your time, and I want to make sure that you get as much value as possible in the 1 hour of commitment. Any questions so far, please feel free to ask. If you would like to ask those questions later, that is also fine, because we would monitor this Academy channel for several days and weeks, because we are still ongoing. We still have 4 more trainings to do. So you can always come back and ask more questions. We will be happy to answer. Now, I would like to tell you that there are a couple of bonuses as part of this training. You would be able to download an infographic to remind you of what the smart way for smart staffing is. So, support team, can you please identify where this infographic is located? And I would also like you to take a few minutes and do a session evaluation. And all these questions are very, very important, because as I said earlier, when you complete these questions, it will help us to help you with your 2024 success plans, because your success plan is going to be individualized only for your need. So these are the places where you can find resources. The slides that I covered, you will be able to download them there, as well as you will have a nice infographic that you, if you want, you can print it or save it digitally, or you can always come back and use it for your purposes. Let's take the last poll of the session today. Thank you for taking time to fill the survey. And while you were filling the survey, we had a question, and let me answer that first. This question came from Mike Sizemore, whether this training that we saw was part of Clarify AI, which is the software that several of you on the call use. So the answer is, Mike, this is a plugin from YaHR that integrates seamlessly with the system of Clarify AI. So people will see the training still in the caregivers will see that training in their main app, but the plugin is an add-on to Clarify. I hope that answered the question, and I think the team is there. They will be able to follow up with you in more details. Now, as we conclude the session today, let me remind you that we will be meeting for 4 more weeks, and I am very excited about the session that we are going to do next Wednesday. So please make sure to attend that session. That will be on operations management, especially if you are worried or thinking about improving your cash flow. What are the things you can do to improve your cash flows, improve the operations, the critical processes, scheduling, billing, payroll, all those activities which are mission critical to provide the good service to your customers, your clients. We will be discussing those in our next session. So I look forward to see you then. And in the meantime, if you have any questions, please feel free to come back to Academy, send them in the chat or the message, and we will get back to you. Until then, goodbye.